right, welcome everyone. We're so glad to host this event today. I'm Katie Moore. I'm the CEO of the Virginia Funders Network. And today we're going to be talking about philanthropy's role in maximizing the American Rescue Plan's community impact. We have a pretty packed agenda and only an hour to get through it. So I want to move right along. We're going to open our session today with a presentation by the team at Deloitte, who I'll introduce shortly. They are going to walk us through the tool that they have created to track the nearly 300 funding streams created by the American Rescue Plan and also other federal stimulus bills that have been approved since COVID started back in March. And then we're going to hear from the folks who are up on the screen now. We've got 4 of our members who are going to talk a little bit about what their organizations are doing to advocate for funding allocations for ARPA in their own communities. And then we've got Robin Mockenhaupt, who is the Director of Policy and Advocacy for VFN, is going to talk a little bit about the playbook that VFN is pulling together to help members lean into ARPA and some advocacy around funding allocations. So without further ado, I'd like to turn it over to Damon Armini. He's with Deloitte, and he's going to talk a little bit about Deloitte's funding tool. Damon, take it.
Hey guys, how's it going? As a fellow Virginia resident, I'm actually really excited to talk about this. Don't mind the background. This is actually Sacramento. I'm over here doing some similar work over here. And dialing into this call, thank God for technology. So here in a minute, we're going to walk you through this tool. Now, any of you who've ever done federal grant work or worked with federal grants understands how complicated the environment is between policy and regulation and shifting guidance and, you know, how exactly is your organization registered and is it got purple paper or pink paper and everything else, right? Like it's just complicated. And so we thought to ourselves as we were working through the COVID grant environment, how could we make this a little easier? And so what we did is this brainchild occurred with our team back with CARES. And it took us a little while to get to the point where we were like, you know, how can we really get after this? What we've done is we've taken all the federal records, all the federal systems, all of the available regulatory guidance, policy frameworks, legislative frameworks, and put them all into a Tableau system. So now what you can do is you can say, for example, I am a charitable organization and I want to look at grants related to broadband. And the tool will filter out of the American Rescue Plan Act those specific grants that apply to charitable organizations and broadband. Right, same thing for homelessness and states or however you want to do it. Now, you're still looking at a little bit of it. It's not quite beta anymore. We've got version 1 out. And so we're continuing to refine as we go. But take a look at what we've got. Sasha and Natalie are going to talk through it here in a few minutes. We're extraordinarily proud of this tool. We're seeing it utilized in California, Florida, Puerto Rico, and New York, across a wide variety, and St. Louis, Missouri, across a wide variety of use cases. Ask questions. Even if I don't have an answer, I will come up with something. And I really look forward to showing this to you. So with that, Sasha and Natalie.
Yeah, my name's Sasha. Oh, sorry, Natalie. My name's Sasha, and I'll be walking through the tool with Natalie. We are 2 of Damon's team, part of a broader team that's helped in developing this tool.
Thanks, Sasha. And yeah, my name's Natalie Hutchison. I'm a senior consultant with Deloitte. Primarily work in crisis and grants management and have largely been focused on the COVID pandemic and federal funding that's been released as a result of the COVID pandemic over the last year. So Sasha, if you want to go ahead and share your screen, we're really excited to show you our tool.
Can you all see that?
Yes.
Perfect.
So this is a tool, like Damon said, that we've built out over the last few months and has gone through a few iterations since the original CARES Act came out in the fall. When the original CARES Act came out, we saw there were all of these different funding sources that had been released, and a lot of our clients, whether they were states or localities, were a little confused on all of the various funding streams that were out there and how to use the funding streams that existed. So we created this kind of Tableau dashboard to be a more interactive view of all of these funding streams that are available to help and assist localities, organizations, et cetera, fully be able to utilize all of the funds that have been made available as a result of the American Rescue Plan Act. So this tool that we're going to walk you through today is largely focused on the American Rescue Plan Act, but it does have the capabilities to build in other grants as needed. So we have three main tabs in this tool: the funding source overview, the applicant funding summary, and funding source details tabs. Sasha, if you want to navigate to the funding source overview tab, I'll give a quick walkthrough through these. So this tab is largely just a high-level overview of all of the funding streams from the American Rescue Plan Act that we so far have input into our tool. You'll see over on the left-hand side, there's $488 billion so far reflected in the tool. Obviously, this is much lower than the $1.9 trillion allocated as a result of the American Rescue Plan Act, but we're only including those numbers in the tool that have been so far confirmed. So for example, if the CDC had a bucket of $20 million for vaccine management activities, we're only including that $20 million when the allocations have been confirmed to different organizations. So if nonprofit organizations in the state of Virginia were to apply for and receive those funds, then those funds would be reflected in this tool. You're also able to scroll over individual states. If you scroll over like the state of Virginia, you can see that currently there's $10.9 billion that have been allocated, and that information is publicly available across 237 different recipients. These recipients could be, as listed below, states, localities, also state departments or agencies, education entities, et cetera. We have 17 different groupings of applicant categories within this tool, but this is kind of how we've shaped it and what we found is most applicable for users of our tool. Over on the right-hand side here, you'll see this eligible funding source identifier. We found this was really helpful when we were originally working on the CARES Act. We had different organizations or localities come to us and say, hey, I want to pay for PPE. Do you know if that's an eligible cost? Is it an eligible cost under multiple funding streams? Do I need to be worried about potential deobligation of funds if I were to use more than one funding stream? So we kind of created this comprehensive listing of all of the eligible costs that are eligible under each unique funding stream. So you're able to kind of use this tool to figure out, you know, if you were a state and you were interested in costs related to broadband, you could select from these eligible cost dropdowns we have here and see which specific funding stream broadband would be eligible for a state. So if you see here, and you were a state who found that broadband was an eligible cost, you could see that a funding source available for that cost would be the Coronavirus State Fiscal Recovery Fund. And that kind of leads us into our second tab. So if you were to find that this cost was eligible under this funding stream, you might want some additional details around what application deadlines or fund use stipulations might be associated with this funding stream, which is what our third tab, funding source details, is used for. If you want to navigate to that, Sasha, thank you. So if you wanted to select, we have a whole drop down of all of the funding sources that are so far input to the tool. Currently, we have Head Start selected. Head Start is a program that has a lot of costs that are eligible for nonprofit entities. So we had just pulled this one up as an example, but you're able to pull up any funding source that you see listed in this dropdown. So the type of information included on this page is overall descriptions, what's the overall use of the funds, how much was allocated across the nation and territories, if there are any application deadlines associated with it. We made sure to include application deadlines in this tool because, again, with the CARES Act, there were some organizations that just weren't aware of funds that they were missing out on. So application deadlines might be coming in the short term or had already passed. And there were a lot of organizations and localities that were just missing out on funds. You can also use these 4 buttons, the description, funding, reporting, and additional information buttons, to kind of get some other information. So if you click on the funding button, you might see some more specific stipulations around when you might expect to receive the funds, if there's any certain expiration of funds. So do you have to use the funds by a certain date? If there's any specific areas of cost sharing or management and administration percentages, that would all be listed here as well. Reporting requirements, that's our 3rd button. Again, this is an important one, and information is continuing to be published on all of these funding streams, but a lot of the funding streams within CARES and within ARPA have more specific documentation requirements than some of the grants that nonprofit entities might be used to, or other localities might be used to. So we're making sure that we're tracking all of these to help ensure there's no potential deobligation of funds in the future. And then this additional information button is just any other information associated with the funding stream that might be important for any applicant to be aware of. You'll also see on this page a repeat on the right-hand side. That is just a comprehensive listing of, for whichever funding source you selected on the left-hand side. Those are all of the costs that are associated with that funding stream and the applicant category. So as Sasha showed, you can scroll down and see for nonprofit entities, here are some of the costs just within this funding stream that would be eligible under that specific funding stream. So I'll quickly pause there before we go to the last tab. Is there any questions so far on the first few pages?
I did want to highlight one thing real quick. So as we were talking about, funding itself won't show until there's an allocation. But as soon as regulatory guidance is promulgated, the grant will go into the tool. That's just so you understand the difference. So like if you're looking at using the tool to try to identify when to apply for grants, then as those guidelines start coming out of the federal government, they'll be populated in here. We won't show the actual allocations until we can say, okay, you know, Virginia got this, or Missouri got this, or what have you, because otherwise we would be speculative. And we're trying to avoid doing that.
Yeah, and that's a really good point. And also just kind of to further prove that we're not pulling this information out of thin air, we're linking wherever we pulled the information from. So if you see over on the left-hand side, we have the bill linked, so HR 1319, and also as you know, Head Start or the HHS comes out with additional information around this guidance or additional confirmed allocations, we'll be putting in those links as well. So for example, the Coronavirus Fiscal and Recovery Fund has released a few different iterations of FAQs and guidance, and we are inputting those links as well as we add that information.
Deborah, we are trying to build that. We are working on building that capability in. It is not yet functional because you either get one of two things. You get no emails or you get like 700,000. So every time we go in and make any little tweak. So this goes back to this being version 1.0.
Yep. And then Sasha, if you want to scroll over to the last tab. So this last tab is really interesting, and it's one of the ones I'm most excited about. So on this tab, you can kind of see a more zoomed in view of each individual state or territory. So right now we have selected, you know, the state of Virginia, and you're able to see a county and metro city or locality breakdown of how these funds that have been confirmed are distributed. So over on the left-hand side, you can kind of see the distribution of how the funds went to states, localities, metro cities, et cetera. You can also see from where all of those funds are coming. So that funding source breakdown breaks down those individual funding sources. Over on the right-hand side here is just a map of the state. And you can also show the data table if you wanted to look at some of the individual numbers here. And just compare how each county or metro city gotten a certain amount of funds. If you want to hide the data table and then switch to the county specific view, we'll just show this last functionality that we recently put into the tool, locality applicants. So with this view, you're able to see the distribution of funds at the county level. So the darker in blue a specific county is, the more funds that specific county has so far been allocated. These dots that you're seeing here is another functionality that we added into the tool, which is this data overlay capability. And we put in some sample data overlays here. The data is real, but we just chose some different data sets that we thought the group might be interested in. So for example, if you go to the data overlay, you can see there's a few different overlays here. We'll look at unemployment rate. So this is the unemployment rate percentage as of March 2021. And you can see as these dots change, the darker red and larger a dot is, the higher the unemployment rate percentage for that specific county is. So this is really important for some of our clients when we're helping them, think through, for example, one of the clients that we're working with, their big priority is combating homelessness. So overlaying some data around the percentage of the homeless in certain areas is really helpful in kind of strategizing how they want to use their funds and how they want to redistribute some of their funds to the areas with a higher percentage of a homeless population. And this is also something that can be tailored depending on your specific nonprofit or organization's needs. These are data sets that can be tailored to whatever your specific priorities are. So I'll pause there. Damon, if there's anything you want to add on to this?
Yeah, of course. So Sash, do you mind showing Title I schools real fast? So one of the reasons why we put some of these different data sets in here is, well, some of the reasons why we chose specific data sets, for example, Title I schools, is because it serves as a proxy. We all know that Title I schools are generally low-income schools that, almost inevitably lack resources. We know that there's a connection between low-income students and missing school and their ability to catch back up, right? Relative to higher income students and their ability to access other educational resources while they're not at school. One thing that one of the reasons why we structured this is if we look, you can see how there are some counties in here that only have Title I schools, but those counties may have only received $400,000 or $500,000 directly from the Fed. So what this does is help you identify areas where there could be need that is being unaddressed. So with that, I know we're running short on time and we're hitting the end of our agenda, our part of the agenda. And I know as much as everybody likes listening to me pontificate, we are available to answer any questions. So you can reach out to anybody on this call or I guess through Katie. If you need to get us questions, we're happy to answer them. And I appreciate your guys' time.
Thank you guys. It's such incredible work and it's really a game changer, as I put into the comments. The funding streams are so complex. No one really understands it. And I think unless it's just you guys, you have unpacked all of this information, and we're going to be working with the Deloitte team to try to get our members access to this information, maybe not direct access to the tool itself, but hopefully get the information that we need to advocate for funding allocations in our communities. So stay tuned for more information about this. I hope everyone is as excited about this information as I am. I just think it's a real game changer for us. So what we want to do now is hear from a couple of our members who are already working in their communities to maximize the American Rescue Plan's investment in their communities. We have Mary Fant Donnan here. She's the executive director of the Allegheny Foundation. It's a health conversion foundation in Covington. She's also a VFN advisory board member. We have Heather Peeler. She's also an advisory board member and is the president and CEO of the Act for Alexandria, which is a community foundation in Alexandria, Virginia. We have Dr. Bill Hazel with us. He's the senior deputy executive director of the Claude Moore Charitable Foundation in Fairfax. He's also former secretary for Health and Human Services for Virginia. And he's also one of the driving forces behind the creation and launch of VFM. And finally, we have Tanya Perkins Ramawi. She's a program officer at the Robbins Foundation in Richmond, where she really focuses on strategies that promote career and college readiness, wealth building, and power building. And we're so glad to have each of you with us. Thank you for joining us today. We've asked each of our speakers to just very briefly outline what their organizations are doing or hope to do and to maximize ARPA's community impact. With only 3 minutes per speaker, we obviously don't have time to go into much detail, but we really want to walk away from today's presentation with some examples of how we can, what our fellow funders are doing in their communities, and hopefully be inspired to take action in our own communities. Directly following our presentations, we're going to move on to our next section of our agenda. We're going to turn it over to Robin Mockenhaupt, who's VFN's Director of Policy and Advocacy, and she's going to briefly walk us through the playbook that VFN is putting together to help members really take action in your own communities with related as it relates to ARPA funding. So without further ado, I'm going to turn it over to Mary.
Good morning, everyone. It's really nice to be together via Zoom. And thank you, Katie, for organizing this session. I looked back at my notes and discovered that on May 5th, we had the very first session about the American Rescue Plan. We'd had references to it before that, but it's been really exciting for me to see what Deloitte & Touche has come up with today and watch that evolve. So I'm going to jump in with sort of 3 comments, sort of broad to specific, more doing, moving towards more hope we're doing in that context. And I work in a rural area, and I think that's helpful for a bit of background. And I'm going to say that in my 3 topics, I'm going to give you something kind of catchy or not, maybe it's too long, to anchor on, and then we'll talk about what we're doing. But it's paired with sort of the challenge we're trying to meet and the solution we're trying to craft. So my first topic is the distance and information correlation correction. So the distance to information correlation connection. I learned when I got here that the further you move from a state capital, the less information flows. So there is a correlation between distance and information. I'd lived in Raleigh, I moved to a mid-city in Winston-Salem, and then we moved here. And what I learned in Raleigh is every morning the coffee pot was a source of information about what happened in the General Assembly the night before. And the next day, when I got to my next job, and we were kind of at the coffee pot, it got infused with a little more local news or family news. And when I moved here, it just didn't get here. So I think one of the best things, and it's a shout out for VFN that you've done with the American Rescue Plan, is help us see the information. And I'm grateful to that function. And I'm grateful again for Deloitte & Touche taking this analytical way of getting this information to forms we can use it in. And our action is to stay connected, use this information, and move to step number 2, which is how do we communicate it? And this is where we move a little bit from what we've done to what we need to do. And I'm going to tag this one, the dim bones song, or dry bones, as some of you might know it. But you remember how the toe bone's connected to the foot bone and the foot bone's connected to the heel bone? Well, it's all very connected, which is a little bit overwhelming. But to make it connected has really amplified a gap that we already knew existed before the pandemic, which is a lot of people are doing things, but we don't always know what each other's doing. And so this need to communicate not only where the opportunities are, but where we have opportunity to move forward together has been particularly hard. And so this conversation has pushed us to think about some work that was already underway and whether we want to have more of a community development organization that is the nexus of all this connection of information and communication, or do we want to think more like a backbone organization? How do we let the information drive the work? So it's pointed out to us that there are still challenges. They aren't new challenges. They don't address, we don't have a system that addresses who's at the table, equity issues, and how we bring everyone forward in our work. But in this information sharing, we've begun to make phone calls. I've lost count at 30 of how many people I've talked to in the last 6 weeks to try to figure out how they're using the money, how they're thinking about the money. And we've talked to our delegate, Austin, who's been really wonderful. He's interested in a convening of some scale, again, pandemic, who wants to come together, how. The communication piece is much harder than we thought. So if anybody's cracked that nut, I'd like some examples, but ours are our activities are pretty basic: email, communicate, and I'm looking forward to seeing what we can do with this Deloitte tush and maybe do some convening. My third and final point is really getting down to a new phrase, strategic nodalism. Strategic nodalism, I made that word up if you're wondering, but I think that in a community-based conversation, it's those points of work that we overlook as foundations sometimes. I mean, we call them our grantees, we call them our affinity groups, but they are the nodes where the work is really taking place. And we have a very active Salvation Army, for example, doing relief work. They've got some money to do housing eviction work. We've got another nonprofit that wants to help with some of the acquisition, renovation, and resale. But in the meantime, our community has really struggled because we have a large market of naturally occurring affordable housing, which is a phrase I've learned in the last 6 weeks, or NOAA. So our housing work is really not well developed, and yet that's a big place where a lot of money is moving out into communities. So we are really trying to figure out how can we build that capacity and increase the impact, and we don't have a lot of impact there. So this is in the hopeful category. And with that, I'm going to turn it to the next speaker. Thank you all for having me.
Thanks so much, Mary. Heather, you want to go next?
Sure. Good morning, everybody. Unfortunately, I don't have any catchy catchphrases to use to describe our work. That was really interesting, Mary. Thank you. So I'm Heather Peeler with Act for Alexandria. We're a community foundation that serves the city of Alexandria, which is a community of about 160,000 people in Northern Virginia. We've been very active with the city, the city government and the health department regarding the use of ARPA funds. It really grew out of our partnership with the city around CARES Act funding that we collaborated on last fall. So last fall, we ran a $2 million grant program for Alexandria nonprofits for direct COVID response. And we also partnered with the city on a grocery store gift card program, which has become kind of a foundational step for a guaranteed income pilot that we're looking to do with ARPA funding. And so the data and the experience from that work last fall informed the city's proposals in terms of the use of ARPA funds. The city anticipates getting close to $60 million, in ARPA funding, and right now is going through a very active process to identify priorities. In fact, the City Council is currently evaluating about a dozen different proposals for the first tranche of ARPA funding. I really applaud my colleagues at the city who've been very active in soliciting community and public input. To support that process as the Community Foundation, we've been making mini grants available to community organizations so that they can mobilize their constituents to engage with City Council and share their perspectives on the prioritization and the use of those funds. And there are two of the 12 or so projects that are under consideration. There are two that ACT would be directly involved in. One is the guaranteed income pilot, which I mentioned. We would not be involved in the mechanics of that. That would really be run by the city, but we would be the partner in terms of public engagement around that initiative, particularly in terms of thinking about narrative change and how to make the case for investing in our neighbors who kind of need that additional support to make ends meet and to take that next step in the economic ladder. The other initiative that we are exploring with the city in terms of using the ARPA funds is a service navigation program. One of the things we learned during COVID is that access to benefits and services is incredibly complicated for most folks. And so you throw in language barriers, literacy barriers, technology barriers, lack of trust in government, and people aren't accessing the resources and programs that are out there. And so the service navigators would be housed within community organizations and organizations that have those trusted connections and relationships with community members and help residents access both at the federal, state, and kind of the local level different resources to help them with the recovery. So those are just a couple of the examples. And I would say from our experience, we've been really focused on figuring out where we can be complementary to the work of city government. So by leveraging our grant making capacity, by leveraging our ability to mobilize both the nonprofit community and others, our ability to work quite quickly and flexibly. Those are things sometimes the city can't always do. And so I think we've been able to figure out kind of what's our way to support, what's the best way that we can leverage, again, our assets and strengths to support the work that the city is trying to do through the ARPA funding. So thanks very much for the opportunity to share our work today.
Thanks, Heather. That's great work. There is a quick question from Christy. She wanted to know if the service navigators are working in tandem with community health workers in the health departments.
So that's a really good question, and that's something that we have been thinking about. We actually see this as a bit of an experimentation in terms of seeing how community organizations want to structure that service navigation. So it's going to look differently for each organization. And so we see this as a bit of a learning lab. So part of the grant process would include regular conversations and convenings with those grantees to learn how they are approaching that service navigation. And so that could be for some in collaboration with the community health workers.
Great, thanks. Really appreciate that, Heather. You guys are doing awesome work. Dr. Hazel, you want to talk a little bit about what you and Lynn and the Claude Moore team are up to in Loudoun, Fairfax, and across the state?
Yeah, nothing terribly nefarious. So Mary Fan, I'm as the orthopedic surgeon on this call, I am the bones are connected by joints and not in the type that's being discussed in the news regularly, but it's those sinewy tissues called ligaments. And I think what we're trying to be are the ligaments here that are holding everything together in the muscles and tendons that power them if we can. But sorry, but I had to pick up on that. I'm going to take a fairly narrow look right now about, I reached out to Don and Deloitte back, 6 weeks or so ago, because there is so much money coming in that I think there will burn a hole in the pockets of the localities. They'll be backfilling and doing what is natural. And the question was, is there a way that we could figure out how we can impact the conversation and the use? And for our mission, it is really about, I think right now, working with the county government in Loudoun to think about how we can strengthen the nonprofit community that provides a number of the services. There is a limited budget in Loudoun that goes to nonprofits. Some of them are very fragile, but they're delivering extremely important services. We have contracted this summer with George Mason's Center for Regional Analysis and the division of the Shar School that's developed a philanthropic management to actually do some studies of the nonprofit community in Loudoun, particularly the ones that are considered critical. And we're trying to figure out what needs to be done to strengthen them, and then where would they get the funding to do that, and how could we use this tool to help us with that. So that's part one. Part two, obviously, we reached out to Katie and all of you, thinking a little bit about is there something that we should be saying collectively about how this money should be allocated. The good news is, unlike the money that came out in 2009 after the recession, that had to be spent very quickly. There is time on this. If you read Bill Leidy's editorial in the RTD 2 weeks ago, I checked with the state, that 120 days only referenced state funding to municipalities, the money that comes to the state for towns. But all this other has a couple years to spend, so we have time. But we also can't waste time if we're going to think about this. And so my concern, and I think our concern, is that poorly spent money will only increase the pressure on philanthropy 2 or 3 years down the road to pick up the ball when the money runs out. So I think we need to be pretty strategic about the investments that are made with it. So that was all I really needed to say.
Thanks, Bill. I really, I know we have a couple of folks on from George Mason on the call today, those folks that are
Correct.
working with you on the study. So that's exciting. We look forward to hearing a little bit more about that. And thanks for your leadership on this and connecting us with Deloitte. We're excited about that work, and we're hoping to, like I said in the chat, hoping to make that tool, or at least the information from the tool, available to members.
Yeah, I guess I could add one thing for the group, since Debbie Owen has been on the background. I think the question here for the group is, are we interested collectively in working together to try to find access to the tool? It's not a one and done thing. They don't just build it and then we go use it for 6 months because the rules are coming out and changing. And the question is are we interested in buying access to the tool for a year's period, a 6-month period, and under what circumstances? So that would be discussion we would welcome later. Thank you.
Yeah, thanks. And once we know more about the tool, a little bit more about price point, et cetera, we'll be reaching out to the membership to see if you are interested in possibly pooling funding, going in together to purchase the information from Deloitte. So more on that soon. But our last speaker today to share a little bit about what the Robbins Foundation is doing related to ARPA funding, we've got Tianka here with us, and I will turn it over to her.
Well, good morning, everyone, and thank you for the opportunity to share. My name is Tanya Perkins, and I'm a program officer of community partnerships with Robbins Foundation. At Robbins Foundation, we focus our grant making on education in the Richmond region. Our CEO, Kelly Chopis, is also having conversations with local and state elected officials to share what we've been hearing over the years and in this moment needs to be funded to be truly transformational. So our CEO is participating in conversations about issue areas related to education outcomes like affordable housing, guaranteed income and wages, and universal pre-K. One thing we should all consider is how the voice of those most affected or those with lived experience, so I call them lived experience experts, show up in these conversations. Each of us knows our needs best and how best to meet them. The same is true for those that we seek to support. So we could establish local and state working groups that include citizens actually impacted by issues, in addition to the usual stakeholders. So something similar to participatory budgeting, or what Heather talked about with making sure that organizations can mobilize the folks that they serve so that their opinions are lifted up. It's also important that we ensure individuals and families continue to receive direct cash assistance, whether that's through guaranteed income pilots, through tax credits, or through rent and utility relief. So direct cash assistance has proven to be effective and well used by recipients. The new child tax credit payments alone are going to completely change what poverty looks like among children and families in our country. And so we need to ensure that those individuals and families that have been left out of CARES Act and American Rescue Plan Act payments receive support, and ensure that those who are eligible know about those resources and how to access them. So for example, I'm working on a convening that would pull together community providers that work closely with families to figure out ways that we can strategically get the word out to families about how to access the child tax credit and the earned income tax credit that they're eligible for now, in anticipation of payments starting to go out in mid-July. And finally, I just say, leverage whatever best practices you learn for policy change. So, given the connection between family financial circumstances and education, the foundation, in partnership with the city of Richmond, supported a one-time cash assistance fund at the start of the pandemic, and then a guaranteed income pilot towards the end of 2020. Given the effectiveness of cash at improving outcomes across the spectrum, so everything from education to health to stable housing and more, it is important that the learnings from these pilots be elevated and baked into practice. And so a task force has formed around the pilot that will start to share local impact, best practices, and lessons learned, which can be lifted up to inform the conversation about a statewide refundable earned income tax credit or child tax credit, and conversations about the statewide social safety net generally, and related topics like wages and employment. Thank you.
Thank you. And that was very succinct, and you guys are doing a lot of work. I know that was tough to pull it down into just quick few bullets. Really appreciate it. So in some kind of miracle, we're actually on time with our agenda, even though we are so packed. Thanks everyone for being so succinct. It was great to hear just what you guys are doing already in your communities. I hope everyone walked away with a few ideas, and there'll be lots more to come around this. But before or I guess in our last 20 minutes here, I want to turn it over to Robin. Like I said, is the Director of Policy and Advocacy for VFN. Robin is formerly the Head of Policy and Advocacy for the Robert Wood Johnson Foundation and retired at the end of the year. She lives here in Virginia, and we're so pleased to have her join the VFN team. She's pulling together a playbook. And so she's going to walk us very high level through that playbook. And we'd love a little bit of feedback from you guys on what would be helpful as we pull together this toolkit for you.
Great, Katie, thanks so much, and good morning, everyone. And thanks to all the speakers about how you're creatively thinking about and working with other partners to use the funds in your communities. So I wanted to, as Katie said, talk a little bit about what the purpose of this playbook would be and how we're thinking about the parts of it, and then really hear from all of you about what you think you would find most useful as a funder in the state, others that you work with, to be able to support your grantees and other community partners. So I see that there are really three main purposes for this playbook, which will be a tool or a resource that Virginia Funders Network can help members and others in the state use. The first one was mentioned by many of the speakers, was how can we leverage the ARPA funds with the funds that we have or others have in our community to have maximal impact to serve our residents. So the first purpose of this toolkit is to, how do we combine funds? How do we think about these funds coming into our state and our community along with other funds that already exist so that we can use them most equitably and most wisely? The second is, how can we use this as an opportunity to build public-private partnerships, to enhance the ones that you already have in your area and to build others in the state? This is a great use of sort of federal dollars that are coming into the state, and then how do we combine that and develop even stronger public-private partnerships? And how do we, as was just mentioned by the last speaker, get community voice involved in that and engage community? And then the third purpose for the playbook, and I think this is something as funders that we think about a lot, is how can we ensure an equity lens to the allocation, the distribution, and the use of these funds? I remember from work in the tobacco wars many years ago that some of the money that came into local states and communities for tobacco funds was used to do things that had nothing to do with public health, but it went into other kinds of things in communities. So how can we think about these dollars best serving what it is that communities need from an equitable point of view so that everybody in the community has a fair opportunity to access them? So that's the reason we want to put this toolkit together and be able to provide resources. And there are really, as we're thinking about it, three main parts to it. The first part after the introduction is to talk about this unprecedented opportunity and how to think about what an equitable recovery is, what are the barriers to that, and what are ways that we can think about using these funds most wisely. The second part is, I think, which is really the meat of the playbook, which is to identify what are roles from funders, from just learning more about what these funds are and how they may be used, to having a more active role with other partners in the community, to maybe taking more of a leadership role and getting engaged in organizing community conversations and follow-up activities and programs that will best serve the needs of your residents. So the second is really sort of a menu of different opportunities for funders in their communities. And then the third section, as we're envisioning it, is a list of resources. Where is there information about a variety of topics about ARPA, about what an equitable recovery is, about what education funders are thinking about, what housing funders are thinking about with these funds, what income security funders are thinking about. So it'll be a variety of other resources. It'll have a model resolution that you can use in your community, a sample op-ed that you might want to publish about the use of these funds in your community, and other resources that you might find useful as you get more engaged with partners and talking with others. So that's how we're envisioning the playbook right now. And we hope that over the next month or so, we can pull these resources together and get them out to you all. But I hope it can be a living and breathing document, because as Bill said, these funds are going to be playing out over a number of years. So perhaps we can evolve this over time and build in more resources over time. But this is what we want to start with. So I'd love to hear from all of you, or any of you that have thoughts about things that you would find helpful in this playbook. What tools, what resources, what information, what don't you know right now that would be useful to you? Or if there's a sample something that you would like, what would that be? So I'll open it up, or turn it maybe back over to you, Katie, to moderate any feedback.
Yeah, and we can take these questions live, or we can put them in the chat, whatever's easiest for folks. I think we want this to really be a bit of a working session, because we do want feedback as we're shaping this tool to roll out to the membership. Also take just general feedback, whether it's about the playbook, the Deloitte tool, or anything we've heard today. I'm going to touch on something that Bill said earlier, and we've been talking a lot about internally here, is that, I think one of our biggest fears is, as we receive this historic infusion of capital into the Commonwealth, that we're a little concerned that, local governments will push the easy button and go back to 2019 thinking. And that's really not what we want to have happen here. We've got, our state coffers are full. Tax revenue didn't really take a hit during pandemic, and now we have this infusion of cash on top of that. So it's a really important opportunity to invest in community and encourage an equitable recovery. And Philanthropy has a real role here, not only to partner with local jurisdictions on allocation of funding, but also to be a little bit of an accountability partner, because we understand community needs and professionally invest money into communities. And so a real resource here.
I have a question, if it's okay, if I can just jump in. I'm curious about cross-jurisdictional work. So in Northern Virginia, at least in our community, the city of Alexandria, Fairfax, Arlington, Loudoun, Prince William, we all kind of overlap in different ways. And so I'm wondering if there's an opportunity for kind of regional collaboration to have our jurisdictions kind of share some priorities, so that not that we're working at cross purposes, but just so that our work can have greater impact for the residents, who really are, I'd say, pretty transient in terms of crossing our various jurisdictional boundaries.
Could I respond to that, Katie? Heather, as secretary, one of the biggest challenges was the fact that the people don't match our jurisdictional boundaries, and the problems do not respect geopolitical boundaries at all. And what happens in each agency or each government entity is they're focused on what they do, and there's generally no resource available to do all the complex, time-consuming work of coordinating and collaborating and things like that. So it just doesn't get done. And we struggle on that with opioids, we struggle on that with housing, and so forth. I'm waiting for Pat to jump in and bail me out here, but that regional collaboration is essential. We have the Council of Governments or the planning districts here in the different regions, which could do some of that as sort of where the government leaders come together, but many of them are not full-time even themselves. So that's an area that requires some work.
So I would not jump in to save Bill, because he can save himself. But I would say that you're completely right with regard to the challenge of regional collaboration in Northern Virginia. I've actually talked to the folks at COG. They're giving some thought to how they might be able to play a role But my suspicion is that it will be easier for us to identify people in local jurisdictions and urge them to come together. And I've started that process as well in Arlington and in Fairfax, because because of the nature of the funding, it's not just asking one person to come and say, talk about education, talk about housing, talk about child tax credits. So we're trying to figure out ways in which to bring groups together with groups of funders, not just one, but the rest of us in Northern Virginia, to see if we can't have a more strategic set of conversations. More on that to come.
Yeah. Katie
Okay,
has
jump
pointed
in.
out that BACO is having some regional meetings, which are related to counties, which might be useful. But if I could jump in with a question before you run out of time. I have talked to the Deloitte folks, and the way they envisioned up till now packaging this product is not just as a tool you log in and use, but with 2 full-time equivalents in a team that would serve Virginia. And the question, while we're speaking of regionalism and collaboration, is are we interested in working together to try to find a way to fund access to the tool for a period of time? If so, there are a lot of questions about that. It's a whole separate discussion probably, but I know that it's the cost of that is probably more than any one of us would want to bite off by ourselves for the value that we would get alone.
Well, this is Lynn. It seems to me that it would be a good thing for VFN to be a leader in this, because that jumps across the jurisdictional lines. It also shows that that philanthropy could have one voice going forward on this. So I would encourage us looking at purchasing this and making this a big part of our first year initiatives.
And my suspicion is that many of us would be interested in purchasing it. The only interesting question is how much. And we all have different thresholds for funding something of this kind. So once Katie and Bill figure out the answer to that question, I think we'll have a better sense of how far we can go with it.
Would there be, we don't see heads on a lot of these because we don't have pictures, and I can't hear rattling on the phone. So I think the question will be, and I don't know how Katie and Robin intend to follow up, but somehow letting us know who's interested so that we could have a separate conversation would be really helpful.
And Patty, I don't know if it's too late, but if we could add a quick question to the feedback survey from this event, asking if folks would be interested in participating in future conversations, that'd be great. If not, we can send a separate email.
No, it's not too late. It just means then that everyone needs to complete the survey.
We have time for just one more question.
Patty, make it the first question.
There you go. Or the last question, so that everyone has to.
No, make it the first question and then they'll keep going.
There you go.
Katie, I'll just jump in and say that if anybody has any ideas or thoughts about the playbook and what would be useful, if you could email either Katie or myself, that would be great, and you'll see it soon.
Just one other thought to throw in, and I think this relates to the playbook as well, is that this is multi-year funding. And so there's things kind of getting started now, but there will be opportunities for us to influence the funding streams in the future over the next year. So I would just encourage the playbook to kind of take a multi-year kind of approach to this and helping us as funders think about that multi-year type of approach.
Thanks, Heather. It's a great suggestion, because I hope we'll be learning some things along the way and can build that in over time. make it a living document.
Well, this is a really exciting moment for the Commonwealth. It's also a really exciting moment for philanthropy. It's a pretty big infusion of capital, as we all know. I think I ran a quick math, and this number may be off, but collectively VFN's 100 members give about 250 million every year. And so a $7 billion investment over a couple of years is pretty incredible and has the potential to really further a lot of philanthropy's goals. And so I'm excited about this work. I'm excited about the potential of having us all work on this together, both at the state level and also in our individual communities. So please, as you think of things that would be helpful for VFN to provide to you, as you think about working in your communities around ARPA funding, please let us know. We're here, we're actively working on this, and we would love your input. We will be sending out, like I said, a survey after this event. We'll gauge your interest in being part of the Deloitte conversation, possibly sharing funding to give us access to that tool. We'll be sharing more information about the playbook, and we would love your feedback about that. And we'll be hosting additional topics around this. So the Education Networking Group's kicking off its first event tomorrow. And some of what we'll be talking about tomorrow is what ARPA is allocating to education and what's that mean? What does that mean for education in our state? Similarly, we're going to be looking at opportunities, for example, ARPA is investing pretty significantly in broadband, in health, in housing, et cetera. So we're going to be digging into some of these topics over the next couple of months. I want to thank all of our speakers. I want to give a special shout out to our friends at Deloitte for now demoing this for a third time for the VFN team. Really appreciate it. And thanks for everyone for joining us this morning. I hope you have a great rest of the day and hope to see you all tomorrow at the Education Funders Networking Group. Thanks, y'all.
Bye-bye.